Hi, my name is Ehren Allen. I'm a physical therapist here at the Jacksonville Orthopaedic Institute. Today we're going to talk about golfer's elbow. Golfer's elbow, also called medial epicondylitis, is a condition where you get pain and inflammation here in the inside part of the elbow. There's a bump here called the medial epicondyle, and there's a large tendon that attaches to this bump, runs down, and then it fans out into multiple tendons and muscles which go down into your wrist and hand. Now, excess stress on these muscles and tendons, which run back up through this common tendon, can lead to pain and inflammation over time. Golfer's elbow gets its name from golf. See, golfers were getting this pain from playing too much golf or just using improper technique. Using old irons can also be the problem. They may be just too heavy for you. If you're having this issue, it may be time to invest in some newer, lighter clubs. Tennis elbow is inflammation at the lateral epicondyle, which is on the outer side of the elbow. Golfer's elbow is inflammation at the medial epicondyle, or the inside of the elbow. There are other ways to get golfer's elbow besides playing golf. It's actually common with racket sports like tennis. See, tennis players who use a lot of topspin put a lot of stress through that medial epicondyle over time, and this can lead to inflammation. Using improper lifting technique or lifting items that are too heavy for you over time can also wear on this medial epicondyle and the common flexor tendon. Treating golfer's elbow is similar to the way we treat most inflammatory issues. We usually start with the R.I.C.E technique. That's rest, ice, compression, and elevation. These are common for the first 2 to 3 days after any kind of injury or acute inflammation. If the R.I.C.E technique doesn't take care of the golfer's elbow, it may be time to go see a physical or occupational therapist. They may do Graston therapy, laser therapy, stretching and strengthening exercises to help encourage healing. In more severe cases of golfer's elbow, a physician may order anti-inflammatory medications, or they may do injected anti-inflammatory medications. Now, when you go to the doctor for golfer's elbow, they're probably going to order an x-ray just to make sure there are no fractures in the area, especially if you're having a lot of acute pain. MRIs are pretty rare for this, and surgery is very rare as well. So if you have elbow pain, the Jacksonville Orthopaedic Institute can help. We have the area's largest group of orthopedic and sports medicine physicians here to help you get back to the top of your game. So call JOI 2000 or go to joi.net to schedule an appointment today.